Hello, ladies and gentlemen. Welcome to Triple N. I am Dr. NIK NIKAM. A friend of mine asked what kind of insurance she can get for her parents coming from India who are 65 plus years. So let me walk you through what kind of insurances are available for immigrants or immigrant parents who are coming here to the United States who are 65 years or older. Let's look at Medicare for Americans over 65. So this will give us an overview of what kind of insurance is available for people over 65 and how we can replicate that to our immigrant parents who are coming from abroad. Medicare has A, B, C, D parts. What I call as the Medicare A, B, C, D alphabet soup. Medicare Part A represents hospital charges. If you have worked for 10 years or 40 quarters or 120 months and you have paid into Medicare, then you are automatically eligible for Medicare Part A. 3 months before your age 65, you can apply for Medicare Part B, but it's going to cost you. Medicare Part B costs anywhere from $150 to $175. That only covers 80% of your charges. You have an annual deductible, and it does not cover like a lot of other ancillary services like nursing home care or home assisted health, things like that. Then we have Medicare Part C, which is called the Medicare Supplement, which is provided by insurance companies like AARP, which is working through United Healthcare, or any number of insurance companies like Blue Cross, Aetna, Cigna, Humana. All of them provide Medicare Supplement, which is an insurance that covers what Medicare doesn't cover in terms of co-pays and deductibles, but it doesn't cover any ancillary services that are not covered by Medicare Part B. Then finally, we have Medicare Part D, which is a prescription plan which pays for part of your prescription costs. I said part of your prescription costs because it's a very complex formula which is based on so many different variables, but nonetheless, having prescription plan helps, especially if you are on 6 to 8 medications. The insurance company that provides Medicare Supplement generally also provides a prescription plan for approximately $50 to $75. So this is a comprehensive coverage that you can get when you retire at age 65. But when you add up all these costs, it will come to approximately $350 to $400 a month if you want to have 100% coverage for your doctor's fees and outpatient services and part of the prescription plans. Now let's look at what's going to happen when you get a parent or parents from India, Pakistan, Bangladesh, any other country for that matter. Then you want to get them a comparable health insurance. Well, when someone immigrates to United States for the first time and they are over 65, they are not automatically eligible for Medicare, just like you and I are, who have worked for more than 10 quarters. So what are the options available for them? Well, in fact, they can get Medicare Part A and Part B and the other supplemental insurance and prescription plans, but there are time limitations and much higher deductibles. Let's start off with Part A. First of all, a new immigrant is not eligible for Medicare Part A until they have spent 5 years in the United States. After they have been in the United States for 5 years, they are automatically eligible for Medicare Part A, and it is advisable for them to sign up for Part A, which approximately costed $512 in year 2015. And they will also be eligible for Medicare Part B, which is provided by Medicare, and they need to sign up when they sign up for Medicare Part A. If they delay signing up for Part B, there may be some penalties which will increase with the time lapse. Once you have Medicare Part A and Medicare Part B, then you can go to private insurances like AARP or Blue Cross, Cigna, Aetna, Humana, United Healthcare, any one of these, and buy Medicare supplement. These are all approximate numbers. And then you can also buy a prescription plan. So if you have an immigrant parent who is over 65 and if they lived in this country for more than 5 years, then they would be eligible for a comprehensive medical coverage just like you would have if you worked in this country and paid into Medicare for 10 years or more. However, their cost of this comprehensive Medicare coverage would be much higher. Here we are looking at $500 plus 150, 800. You're looking like $900. But that $900 will get you a very comprehensive health coverage, but it doesn't cover for durable medical equipments, eyeglasses, or for example hearing aids or a home health care, things like that. But nonetheless, this is a very comprehensive coverage for an immigrant parent who never worked in this country but can enjoy the privilege of Medicare. And there are several advantages to having Medicare versus a private insurance. Number one, Medicare, you do not need authorization for each and every test, a visit, or an x-ray. You can go to any doctor you like. You can visit any hospital you like. So you have the whole gamut of hospitals and doctors from whom you can get medical care. That is one of the biggest advantage of having Medicare versus having a private insurance, which may be $100 to $200 cheaper, but you're giving up a lot of privileges in terms of limitation of doctors and hospitals and many, many more things. So this is the coverage that is available after your immigrant parents have lived in the United States for more than 5 years. Well, in the meantime, what are we going to do? They are already here, and what kind of insurance coverage they can have? There is what is called the New Immigrants Insurance, which has been started for those who have come to the United States who are over 65 and who are not eligible for the traditional Medicare. And there are also private health insurances which will offer you premiums but which are going to be considerably higher. So let's look at one of these sites. I did some research and let me see if I can pull up that page here. Here is a visitors coverage, visitors travel insurance and newly immigrant visa. And here, as you can see, here's what is called a comprehensive coverage plan for green cover. Those who are over 65 who have recently come to this country, and these the coverage seems to be pretty reasonable. And let's look at some of the things that are covered here. And as you can see, doctors' visits are covered, surgical treatments are covered, prescriptions are not covered, labs are covered, x-rays, inpatient Part A and Part B are covered. And so there's a pretty good coverage. And let's look at what the costs are. They cover Part A and B. So now we have to remember, if your parents are 65 and older and they are here and they are not eligible for traditional Medicare, they can get this comprehensive coverage for new immigrants. Part A and B, which for a 65-year-old person with $1,000 deductible is 12 something like that per, or say like this is like $10 here, $10. That means $3,500 or $3,600 per year. Plus you have the deductible, which is $2,500. Then you have to get the supplemental insurance. Then you have to get a prescription plan. So that means there is an option for the first 5 years they are in the United States as a new immigrant to purchase this private insurance. I'm sure there are many other insurance companies that provide this private insurance. You just have to Google and look around. Our best thing is talk to one of the Medicare insurance provider representatives or agents. So they can show you a whole gamut of different options available. In that way, you will be able to make a meaningful judgment. Well, ladies and gentlemen, I hope I have not confused you too much. In case I have confused you and created a lot of stress, I would suggest you can just download a copy of my book, Stress Free Lifestyle, which is available on Amazon.com for less than $5. And you can read at your leisure. And I'm sure you got plenty of time to just browse through this book and enjoy it and reduce your stress. Ladies and gentlemen, please do subscribe to our YouTube channel. And it is very important that you subscribe to our YouTube channel. That's all, folks, as far as getting insurance for your parents. If they are 65 years and older, what do you do during the first 5 years when they are not eligible for Medicare, and how you go about getting them comprehensive Medicare coverage after they have been in this country for more than 5 years. I am Dr. NIK NIKAM, and you're watching Triple N Media, and please do subscribe to our YouTube. We'll see you next time. Thank you.